Hair loss, hair thinning, graying of hairs. It has become a very common problem today. कोई भी एज ग्रुप हो, कोई भी जेंडर हो, मेल हो, फीमेल हो, यंग हो, ओल्ड हो, मिडिल एज ग्रुप के लोग हों, everybody is facing this problem. So today in this episode of Tea Time and Gossip with me, Dr. Aparna, let us understand and talk about the various reasons why we are losing our hair or there is hair thinning, and also let's understand what can be the precautions or management we can do to save our hairs and have a healthy long hairs. So before getting into the reason, let us understand how the hair growth cycle works. So basically hair growth cycle works in four phases. Number one phase is the anagen phase, which is the longest phase, and it is called the growth phase. In this, the hair roots divide at a very faster rate so that formation of new hair strands can take place. Then comes your catagen phase. Now this is basically an exfoliation phase where the hair follicles are now gradually detached from the blood supply, so they don't receive any nutrition now from the scalp. Then comes the telogen phase. Now this is basically a resting phase because the hair is no longer connected to the food supply, but it is yet not ready to shed off. Now last phase is the exogen phase. Now this is basically a shedding phase when the hair follicles are shed off or fall. Now understanding the various reasons. So number one is the most common one, which is called the androgenic alopecia. In this, if seen in males, then you will see that the hairline is receding and there is baldness coming basically in the crown region. Okay, and in the females, if this type of androgenic alopecia is happening, then there's basically hair thinning, which is head basically on the top or the crown of the head. This type of hair loss or hair thinning is basically in the genetics, commonly in males, and if in females, then it is basically due to hormonal imbalances. Now PCOS is a very common and a very classical example of this, in which number of androgens, that is testosterone, is more. So this testosterone gets converted into dihydrotestosterone, that is DHT. When this DHT is formed, then the hair follicles are basically shrunk. When there is a shrinkage of the hair follicles, then what will happen? The food supply or the blood supply to the hair follicles will be lost, leading to hair fall or hair thinning. Another thing, during PCOS, basically insulin resistance happens. In insulin resistance, more amount of insulin is formed in the blood. This triggers the ovaries to produce androgens, that is testosterone and DHT, leading to hair fall and hair thinning. If you want to know more about the insulin resistance and PCOS, then you can check out my more episodes. I have published a total series on PCOS. Then many of the medical conditions can also lead to your hair fall or hair thinning. So number one is your autoimmune conditions where the immune system attacks your own hair follicles, leading to patchy hair loss like alopecia areata and the scalp psoriasis are the common examples. Then fungal infections, localized or systemic, is a very common reason why hair fall or hair thinning happens. Apart from this, many of the medications which you have been using can be the reason for your hair fall or hair thinning. In this, number one drugs are the chemotherapy drugs, basically used for cancer treatments. Then comes your anticoagulants, the blood thinners like the warfarin and heparin has also shown to increase the hair loss or the hair thinning. Then next in the series is the beta blockers. Beta blockers like propranolol, metoprolol, atenolol, most commonly used for heart disease. Now, if you are using this medication, now this can be the reason for your hair fall or hair thinning, because these medication forces the hair follicles or the hair cells to enter into the resting phase early. So your growth phase, which is the anagen phase, that is reduced, and the blood supply or the food supply, nutrition supply to your scalp, to your hair follicles, that is also lost or reduced, leading to hair fall and hair thinning. And next is your antidepressants like Prozac, like Citrulline, like Amitriptyline. What happens? they affect the neurotransmitter or the hormonal balances in the body, which impacts the hair growth. Now, stress, depression, anxiety by itself can lead to your hair fall and hair thinning, because a chronic or continuous depression, anxiety and stress leads to increase of cortisol level, which will cause the hormonal imbalances. Now these hormonal imbalances are by itself related to your hair fall and hair thinning. Then comes your anticonvulsants, the medications which are used for seizures like valproic acid, carbamazepine, phenytoin has also been related to your hair fall and hair thinning, because they reduces or blocks the absorption or metabolism of the vitamins and minerals like folic acid, zinc, biotin, iron, etc., which are very crucial for the hair growth. So if you are using any of such medications, then these can be the reason why you are losing your hairs. Then coming to your thyroid medications. So if you are having hypothyroidism or hyperthyroidism, in both the conditions, your hair fall and hair thinning can happen. Because in hypothyroidism, the T3 and T4, these are the two thyroid elements which pushes the hair follicles to enter into the resting phase early. So the blood supply, nutrition supply is lost, eventually leading to hair fall or hair thinning. In hyperthyroidism, this T3, T4 hormones are more, they are in excess. So the hair follicles go through this anagen phase, that is the growth phase, very quickly than the normal, leading to hair fall and hair thinning. Now, many nutritional deficiencies can also lead to your hair fall and hair thinning. These are iron, protein, vitamin D, vitamin B9, vitamin B12, and zinc. Most important for your hair growth. Then, lifestyle factors. Like if you are living in an area where the water supply is very bad, this can lead to your hair fall or hair thinning problem. The place where the air pollution is more, that can also be a reason for your hair fall and hair thinning, because this water or air can be the reason of a heavy metal deposit in the hair follicles, which will ultimately cause the hair follicles to shed down early. Then if you're a chronic smoker or you're a chronic alcohol user, then make sure you will be having the problem of hair fall and hair thinning, because the blood supply to your scalp will be reduced. So these were few reasons for your hair fall or hair thinning. Now let's talk about the management or the treatment. So if you opt for the functional medicine approach, so we will be finding out the root cause of your problem, that why are you having this hair thinning and the hair fall problem. So in this, number one, we will be asking you to do some of the blood test, some of the gut test, which will include the urine and the stool test. Then comes the dietary changes. The dietary changes includes removing all which is inflammatory. Inflammatory means removing all the sugar intake, salt intake, then remove the wheat intake, that is gluten basically, and remove the dairy intake. Then what to have? Have the food which are anti-inflammatory, include millets in your diet, which are positive foods. Then have omega-3 rich foods. These are the fishes, these are seeds like the soaked chia seeds, flax seeds, sesame seeds. Then you need to include A2 Bologna ghee in your diet. Take much more of coconut oil. Avoid using mustard oil or any seed based oil, or maybe refined oil or sunflower oils, because they will increase the inflammation in your body. Then soaked nuts like the almonds, walnuts should be a part of your daily diet. Then increase the protein intake. So you can have a good plant-based protein, or include more of dals, chickpeas like chole, chana, rajma in your diet. You can have it in the form of low spice curry, or maybe in the form of salads. Then you can have some moong dal chila, you can have some besan chila, besan ki roti. Then for people who take non-veg, then organic country fresh eggs are a very good source of protein. Then organic chickens, take organic chickens, very good source of proteins. Then you can also include some of the superfoods in your diet. Superfoods can be your moringa, can be your ragi, Then can be your different form of millets. These are the superfoods. Then include ashgard, safed petha in your diet. You can have it in the form of detox juice. You can have it in the form of your vegetable soup. These are very good for your hair health and your overall health also. Now coming to the supplement part, so as per the report of your blood test and the gut test, that is the urine and the stool test, we will be prescribing or recommending different type of supplements which will reduce the inflammation, which will reduce any form of infection present, that will increase your immunity levels, that will suffice your deficiencies or the insufficiencies of the various vitamins and minerals, that will also improve your gut health through the probiotics use and the prebiotics use. Now coming to your lifestyle factors, so if you are a smoker or an alcohol user, so please avoid doing any smoking or alcohol use, because that also have a very wrong impact on your overall health. Then please avoid usage of any chemical based shampoos on your scalp. You can prefer using any of the organic shampoos. There are many of the online stores where a lot of good quality organic shampoos are available. Then avoid any chemical usage on the scalp, on the hair, which you are commonly using for the hair treatment or for the hair styling, because that have a very wrong impact on your hair follicles, ultimately leading to your hair thinning and the hair falls. Then washing your hair every day with the shampoo is not a very good practice. 2 to 3 times a week is okay. Otherwise, you will be losing the natural oil present in your scalp, on your skin, which will cause dryness and itching of the scalp, which also increases the dandruff problem. I will make another episode on this dandruff issue. This will also be the reason for your hair fall and hair thinning. Then when you are cleaning your hair, avoid usage of very hot water, which we basically do in the winters especially. The water should be normal temperature, because if you are using hot water for cleaning your hairs, then you are damaging your hair follicles, which can also cause your hair fall and hair thinning. And then if you are stressed out, you are anxious, you are depressed, then please manage all these things. Take a proper medication for this thing. Practice journaling, talk to your friend, do meditation or whatever to control your stress level. And if you think due to any of the medication your hair fall and hair thinning is happening, then it's better to talk to your doctor and get that medication changed. So that's it for this episode. I hope it was very useful for you and informative also. So please like it and share it with all those peoples who are dealing with problem of hair fall and hair thinning. You never know, you are helping them out. And if you like my content, then please subscribe to our channel so that we can grow with your support. Thank you all. See you again with another episode of Tea Time and Gossip with me, Dr. Aparna.